Good afternoon. Good morning. Who knows? Depends on when you're showing this to your employees. But anyway, we're back on part 2 of the COVID-19 and the workplace. And what does OSHA say? Well, a couple things they want you, several things they want you to do. One of them is to assign at least one individual with infection control experience or training to monitor and manage your workplace and manage response activities. Now, infection control isn't just saying, oh man, the guy's got a runny nose, I better do something. Infection control training should be one person, and that one person should attend some training. Now, it just so happens that we can do that for you, and we'll be holding some classes coming up where you can send a person. It'll be several hours, and we'll have you know how to deal with infection in your workplace. Not just COVID either. It could be any infection that runs rampant through the workplace. And then you need to train your staff to recognize COVID symptoms to help prevent infections. If you're working next to someone and they got symptoms, they need to recognize them. They need to know what's going on to prevent infections, to prevent hospitalizations, and in some cases, prevent death. And then you need to know to report cases to both OSHA and Virginia Department of Health. They have certain criteria where they need to be notified. And then educate employees, staff, and visitors about COVID-19. Make sure, when someone comes in the plant, comes in the office, you need to make sure you offer them a mask. You ask them those 4 questions we've gone over a couple of times already. And if needed, if your company does it, make sure you take temperatures. These things are important to protect those folks and protect your own employees. And then, as I said, make face masks available for everyone. Now, if you're going to go to a training class, the top picture is not the way to do it during COVID. The bottom picture is how to do it during COVID. So if you're getting everybody together in one room to watch this video, then the bottom picture is what you want to do. You don't want to do the top picture. Any training you do should be done this way. Any meeting you do should be done that way. And then we need to review Virginia's first in the nation standard for COVID-19. We have stricter requirements than most states. Number one, make sure your sick leave policies are clear. Make sure there's no questions. Make sure there's, if they're going to use their own sick days, they know that. If you're going to provide days off with pay, they've got to know that. Make sure the policies are clear. Make sure you offer teleworking to people who can do teleworking. I know in a manufacturing plant, a guy welding can't do that over the internet, but people in the office can. And make sure that you have staggered shifts. And if you can do that, do so. Modify the incoming times for people. Make sure that if you can have 2 shifts instead of 1, do so. Then provide hand washing stations everywhere. I would put a little bottle of hand sanitizer on every desk, in every cubby if you've got cubbies, in every office. Then put the hand sanitizers on the wall. Have one in the lobby when people come in. Put them everywhere. Hand sanitizers are really very effective. And then assess your risk levels of your employees. Make sure you know who's going to be more infected, more easily infected than the other guy. Make sure that you are sure that they have social distancing. Make sure that they have face masks. Make sure they have face shields if needed. If they need to wear gloves, make sure they do. And then always, as I mentioned earlier, notify Virginia Department of Health of any positive cases. And then notify OSHA, Virginia OSHA, if you have 3 or more positive cases within a 2-week period. So you've got to notify both Virginia Department of Health and OSHA, or Virginia OSHA. This could be, if you don't notify them, this could be a citation. This one company that only had 1 case was notified by OSHA because an employee complained. And the employee complaint was actually not founded on much. The company did everything and was doing everything. But then all of a sudden, Virginia Department of Health was involved. So if you want to stay clear of regulatory bodies, just do the right thing. And then provide the COVID-19 training within 30 days of the ruling, which actually is 30 days from today. So make sure that you get this webinar out to all your people within 30 days. Prepare infectious disease response plans within 30 days. How are you going to, within 60 days, excuse me. You need to have an infection control policy within 60 days, in-house, and trained to all your people. And then make sure you post COVID-19 information to all employees. If we have anybody in your plant who has COVID, everybody has to know. You don't have to know the name, but they have to know that COVID was in the plant. Now, if you have to shut down for sanitizing, they're going to know that anyway. And this is the address and the contact information for your OSHA people, the Commonwealth of Virginia. And maintain your air handling systems. Make sure you do the filter maintenance. Make sure the RPMs are right. Do everything you can according to the ANSI and ASHRAE standards on your HVAC systems. Place requirements. Determine according to what the rules are, whether you have very high risk or low risk. And that's how you determine how employees need to work together. Screen employees. I'm still for making sure that every employee knows, look, did I, over the weekend, did I go to Myrtle Beach? Maybe I shouldn't come back to work for 48 hours until I get tested. Check temperatures. Establish requirements for employees with positive tests. They're going to be out of work for at least 14 days. They have to be tested after that 14 days before they come back to work. You have to lay these things out ahead of time in your policy, and then require social distancing. If it's not possible, provide respiratory protection. And then clean and disinfect commonly used area like a cafeteria, the front desk. If there's a conference room, a meeting room, make sure you sanitize those regularly. After every lunch period, sanitize the tables. After every meeting, sanitize the tables and the stands where we put things. The meeting chairs, if they're chairs or desks, sanitize the room between meetings. And then if you are renting or leasing a facility, your landlord, your owner must inform you of any COVID cases in that building. Because sometimes you may be in one building with 10 clients, with 10 different tenants in the building. And if one of those tenants has COVID, he has to notify you. And then make sure you follow the CDC and OSHA guidance that commonly comes out. Now, this emergency standard takes effect on publication at the end of July, right now. And it's going to expire within 6 months, or whenever the governor decides that he's going to take it away. So we've got to know that this is enforced as of today. You've got to start doing these things. And manage your staff, including you, all right? Take temperatures. I like to say if it's over 100, make that person sit down and wait 10, 15 minutes and then take it again. Because, for instance, I took my wife to a clinic the other day, and I got in my car, and we only had to drive five minutes. Well, the vehicle was like 110 degrees in there when I got in, and when I went in the doctor's office with them, we were both over 100-degree temperature when they took a no contact temperature. You know, we sat down for 10 minutes in an isolated area, and they took the temperature, and guess what? I was 97.8. But you have to make sure that you take temperatures and make sure that you give that person a chance to cool down in case they're in a hot area. Monitor symptoms. Be always aware of what's going on in your workplace. Send people out to be tested. If they've got a lot of, if they have to stay home, they've been exposed, whatever's happened, make sure they are tested before they come back to work. And provide PPE, provide hand sanitizer, provide masks, provide gowns if needed, and limit contact with people. This is a rerun. You already heard all these things, but repetition is often good. Here's a poster you can put up in your plant. We provide these at no cost to anybody who wants it. And we also have it written in Spanish, and we have it written in English if you so choose it. Now, this is not the way for a person to wear a face mask. I put this up because I thought it was kind of comical, but it was real, all right? And that's when you stop. Make sure they're wearing it properly. Now, companies must address these following things in an infection control policy program. They got to assess risk of infection. You got to assess how bad it is in certain areas of your plant. Now, we can help you do this, but that's number one in your policy. Number two, you need to have a plan. What are you going to do if there's an infection? Number three, how you control it. You know, how do you track the incidents? How are you going to know who had COVID-19? How are you going to know who is tested positive? If there's suspected infection, are there any known outbreaks right now? You need to know that. Infection control. What are you doing? Are you providing face masks, social distancing, hand washing, gloves? This needs to be in your policy. You can put these out all over the plant, but you got to put it in your policy that is there. Identify a space where you can make people wait if you think they may have COVID. If their temperature's up a little bit, or they've been doing a lot of wheezing and sneezing, and you want to get them tested, where do you make them go? It's going to be an isolated space that's not a dungeon someplace. Make sure you practice hand hygiene according to CDC. Hand hygiene, glove use according to CDC. Respiratory hygiene is cough etiquette practice. Do you use personal protective equipment? What do you use and when and where? Does your company train the employees on this PPE? What, when, and where? And does your company train on donning and doffing? By the way, in case you don't know it, donning is putting on PPE and doffing is taking it off. Does your company provide isolation precautions? Does your company, what does your company do if all of a sudden you got a whole bunch of employees? By a whole bunch, I mean 2 or 3 or 4, not 20 or 30. What do you do if you have 3 or 4? That may mean you just need to close down and do a plant sanitizing and have your employees tested. Does your company train employees on how to clean respiratory devices if they use them over and over, such as an N95 mask? And those are the rules. I didn't make them. Your owner of the company didn't make them. Virginia OSHA has made those rules. You need to follow every one of them. There is an 18th one, which has to do with medical facilities, which is much more, which we won't get into because none of my clients now are doing medical work. So please, please, don't be one of those companies that gets a citation because of COVID. Don't be one of those companies that loses a contract because of COVID. Don't be one of those companies that has a death because of COVID. Play it safe. It only takes a minute. Thank you for attending. If you do these two parts with your employees, you should be in good shape.